Mm. Oh, God. Mm-hmm. Ooh, wow.
Jessica.
Yes.
So I saw from your chart we're having some neck, some upper back stuff. We're getting maybe some carpal tunnel type stuff.
I have tendinitis.
Okay.
It started here when I first started working from home because I wasn't used to typing 8 hours a day. And then I was overcompensating. So now I have it here. And then it's like now I've been having like this numbness that just randomly comes and it hurts when I drive. Like I have to constantly switch arms to drive. Yeah. I work out, so when I'm doing weighted squats, I feel like I'm just, it's a lot here.
Put more stress on the upper back.
Yes, and then of course, like I said, working from home, I'm looking at computer screens all day, so I feel like I have the ball chair, but I need a bigger one because
gotcha.
now my desk is higher and it just doesn't work. So now I'm back to my computer chair, which is an ergonomics one, but
still for that
really
long,
for
that much time. So real quick again, I want you to show me where you're feeling the tendinitis. Like,
so the tendinitis is from here all the way up this nerve here, and then when it comes to carpal tunnel, now I'm feeling it, the numbness on this side and these two fingers.
Okay, so kind of like middle finger, ring finger, pinky.
Yep, and the pinky's just started. Like it's just like a numbness on the side of my hand, and I feel it coming basically.
Did you see somebody about the tendinitis or?
Yes, I had to go to the doctor. This was 2021. I went to a specialist. I had to go to a specialist. I did physical therapy, and so that's why when I'm in the gym now, I do more weights to strengthen it. So I think I've just been pushing myself too far. Yeah. And then combined with typing.
Gotcha.
So.
Gotcha. Okay. The reason I ask is because when we start to get symptoms that are going down the arm like this and into the hand, especially numbness and tingling, we start thinking about nerve compression in the neck. And sometimes that can kind of mimic carpal tunnel or it can mimic tendinitis. So the first thing that I want to do is I want to do a couple of tests with you and just see if we can differentiate. Is it tendinitis and carpal tunnel and neck stiffness, or is it, just the neck and that's giving you this downstream effect through the nerve? Okay. So that's what we want to find out first.
I'm hoping it's just one and not the trifecta.
Yeah. Well, it's a little bit easier to treat when it's just coming from the neck. So
yes. Which I will say I've had that for a while. I know I carry stress up here, and then combined with working out.
Yeah.
It's terrible.
Okay. Let's have you come on over here. You're gonna have a seat right here for me. And then the tendinitis, are you feeling it like, recently, or is this just something historical?
I've been having chronic flare-ups lately. Okay.
So let's put your hands just like this, okay? Don't let me pull your arm away. Does that increase any of your pain? What about if you push into me here? So push into me.
Oh.
Yep.
Yeah.
Maybe a little bit. Okay. If I pull here, any increase? Okay, and then push into me. Any increase? Yeah? Okay. Now, what I want you to do is bring those wrists up, just like that, yeah. Now don't let me straighten them, so I'm going to pull against you. Does that make things worse? Right through there? Okay, and right here? No. So it does on this side, but not on this side. And then we're going to roll those hands over, and then bring our fists up. And don't really pull it down. Anything get worse? Yeah, what about here? No.
Because this is the primary
a little more sensitive. Yeah, okay. Okay, so that is acting like tendinitis, right? Because the resisted motion is giving you those symptoms. So the next thing I want to see is how sensitive that nerve is. So if you go right here, I just want you to tell me if you get any flare up when I tap you here. Numbness, tingling, nothing? Okay. Nothing?
Oh, now I do.
Maybe a little bit.
Yep, it's just the pinky though.
Okay.
Yep.
So we may have some kind of carpal tunnel. So now what we want to see is, so we know we do have tendinitis, maybe a bit of carpal tunnel. What we want to see is how much of this is coming from your neck.
Okay.
I'm going to come around behind you. So if I push down, I just want you to tell me if you get any symptoms in your arms or shoulder blades. Nothing. If I lift up, tell me if things feel better. Yeah.
Yes.
Really? Now, feels better in your neck or feels better in your arms?
My neck.
Okay, gotcha. If I go here, anything in your arms?
Over here.
Yeah, where in your arm?
It's like back down this way.
Does it feel the same way the tendinitis does?
It's tender, like it's like a annoying feeling versus how the tendinitis is a throbbing feeling. I think.
Gotcha. So slightly different.
Mm-hmm.
What about here? Anything in your left arm? No. So you kind of have a couple of things going on. The fact that we can push on your neck and give you symptoms in your arms means that we do have some sensitivity, irritation on the nerve where it comes out the neck before going down the arm. That may be mimicking tendinitis, or it may just be making your tendinitis more sensitive. So we definitely have, yeah, you felt that. We definitely have the neck situation to deal with. And then what we're going to do today is we're gonna adjust your neck, your upper back. We'll adjust your low back as well. And then we're going to adjust your elbows to try and take some stress off these tendons, and adjust your wrists to try and give you some more. So we're going to kind of do a more comprehensive adjustment, just try to take stress off at all these areas. The fact that I can push on your neck, though, and give you symptoms down your arm like that is really making me think that your neck, yeah, the fact that you're still feeling it too, it's really making me feel like a lot of this is coming from your neck. So you may have some mild carpal tunnel or some mild nerve irritation here or some mild strain on the tendons, but the neck having irritation is going to sensitize all those things. So where, have you ever had a bruise where someone touches you, they're touching you lightly, but it hurts a lot?
I have one of those now, actually.
Exactly. So that's kind of how this works with the sensitivity of the nerve is when you have irritation on one part of the nerve, so maybe up in the neck, the other parts of the nerve become very sensitive even though they're not injured. And so small touches or small sensations can give you symptoms.
Okay.
So that's why we really want to clear up your neck.
Okay.
Were they addressing your neck at all before?
She did, which normally I do myself, and I haven't been able to pop my neck in over a month. But she just kind of did one of those, but it wasn't deep. I feel like she was just testing out to see how it was. And then the other place I went, I won't say their name, but it was, I feel like because they're so commercialized that it was just kind of like a flyby visit. So I don't think I really got what I needed.
And they never did like repeated treatments of your neck to try and focus on that?
No.
Okay. So I think that's what's going on. I think the neck is kind of giving you more of these symptoms downstream. So that's what we're going to start with. So.
Perfect.
Okay, well, let's get into it here. So we're going to start on this lower left side where you felt all that sensitivity, like right there. Okay. So I'm going to hop up here. You'll just lean back against my leg. Good. Okay, so I'm going to turn you a little bit. This is going to be just kind of a quick movement.
Oh, I need to get so bad.
Pretty good.
Turn my alarm off if we want. See, it was like the angels at the right time. Oh my gosh.
Better?
Yes.
Okay. And on this side, we want to find, So this is the level that nerve comes out, like C5, C6.
Okay.
So you're going to have to lean back again. Good.
Man. Whew. Like, I feel like my ear opened up.
Yeah, you can.
I was like, wait. Oh, that's amazing. I needed that real bad.
Okay, so now we're going to work through your upper back, and then we're going to get into your arms and stuff.
Okay.
Let's have you lay on your back for me.
Okay.
Scoot down just a little. Right. Okay, I'm going to cross these arms. So you're going to take a big breath in, blow all your air out. I'm going to squish you. Oh, God. Pretty nice. Yeah. We're going to do one more in that spot.
Okay, do I switch like
No, you're going to be right here. Good. We're just going to go a little bit lower.
Oh, God, yes. Oh, my gosh. Now I know why people laugh. I don't know what else to say.
Okay, let's have you lay on your side facing me.
Okay.
All right, this one's for your low back. And you weren't having a ton of low back issues, were you?
No.
Yeah. So we'll just kind of give you a good ones over here. Good, we're going to go right there. Good. Pretty nice.
Yeah.
If you lay on the other side.
Oh, goodness. That is really good. Oh.
Good. Go right there.
Okay.
Perfect. Okay. How we doing?
Man, listen, I feel like I have a new back already.
Let's take a look at these wrists and elbows, all right?
Okay.
So, loose as you can for me. Just let that flop down, yeah.
Mm-hmm. Ooh, wow.
Okay.
I didn't even know my wrist could do that.
We'll do your elbow.
Mm.
Good. And we'll go here. Good. Okay. Now that's going to help take some stress off those tendons by adjusting the joints they go across. We'll do this wrist.
Mm-hmm. Mm-hmm.
Good. Good. Okay. How are we feeling?
I could go to sleep. Oh my gosh, that feels like the pressure that I was feeling here is already gone.
Okay.
Like it feels like obviously you just did something, but that irritating pain is not there right now.
Okay.
Oh my
Now
god.
the cherry on top is we're going to decompress your neck,
Okay.
which is going to help open up the space around that nerve.
Okay.
Okay. So let's scoot you all the way up to the top here. Perfect. Okay. Now this one's... No, you're fine right there. This one seems scarier than it feels.
Mm-hmm.
Okay, so maybe lift that head up for me.
Like I was telling her, I've been watching videos for a while, so I'm prepared.
You're prepared.
Yes. I'm obsessed, actually.
So you want to make sure your teeth are touching so you don't bite your tongue or nothing.
Mm-hmm.
And then just as loose as you possibly can. I'm going to give you a gradual pull. And then a little quicker one.
Ooh. Down my back. Oh. Oh. I was waiting for that one. Yes. Yes. Oh my goodness.
Was it what you expected?
Yes.
Yeah.
Oh my god, I needed it so bad. Things are happening.
Okay, so let's sit you up.
Oh gosh.
And we'll have you face this way again.
Oh,
And then what I want to do is I just want to check a few of those things again. So
okay.
if I press here, I'm just going to do it nice and lightly. Are we getting anything in the arm or hand again?
Mm-mm.
No. Okay. And then let's go back to right here. Push against me. Any pain? Nope.
I want to cry.
Push against me.
Oh my god.
Any pain? Okay. Let's go here. Wrists up. Don't let me pull it down. Any pain? Any pain?
I really want to cry right now. Like, that is crazy. That is crazy. Like, this stuff hurts so bad daily. Like, wow. Thank you. Thank you so much. Like,
You're welcome. You're welcome. It's a lot to deal with, especially when it's for your work, you know?
yes. So, oh my gosh. And working out. Like, because sometimes I'll have to stop because it hurts too bad. Or it's like too numb and I'm scared I'll drop something. So
Right.
it's like,
Yeah,
keep pushing yourself.
We
So,
don't want you living like that, yeah.
oh, yes.
So I don't want to say that you were misdiagnosed. Right? I want to give everyone absolutely the benefit of the doubt because it was behaving similar to a tendinitis.
Mm-hmm.
But the fact that like when you have a tendinitis, that tendon is inflamed, the tendon's sensitive. No amount of adjusting things is going to make that not hurt when we use the muscle.
Mm-hmm.
So the fact that we adjusted these regions and we took the pressure off the nerve in your neck and now the symptoms are gone and it's not painful means that it wasn't originally the muscle problem. It was originally coming from the neck and it's making these areas more sensitive.
Okay.
And so that's why we went through that process with you of trying to figure out exactly what is making it worse, making it better, and see if we could hone in on what was actually going on.
Mm-hmm.
My biggest clue was the working all day at the desk, right?
Mm-hmm.
It tends to be this type of situation when you're doing work like that. So
Mm-hmm.
to me, that was like, okay, we need to check the neck. So that's what I would say we need to do for you. We just need to continue to treat your neck for a little bit.
Okay. I will be back
Yeah.
because
We'll
I
get you
needed
scheduled.
this. Perfect. Thank you, Dr.
Yeah, of
Poulson.
course, of course, of course.